My study is changes in central macular thickness after cataract surgery in patients with and without diabetes mellitus. Diabetic patients may develop macular edema post-cataract surgery. It can be either the diabetic macular edema or the pseudophakic cystoid macular edema, and the pseudophakic cystoid macular edema may develop in otherwise healthy eyes post-cataract surgery. So macular edema is now regarded as one of the most common cause of visual loss after an uncomplicated cataract surgery. Hence, it is important to quantify the macular thickness changes before and after cataract surgery. The optical coherence tomography (OCT) is a non-invasive method of quantifying the macular thickness. This is an OCT image showing macular edema with increase in the central macular thickness. The aim of my study was to evaluate the changes in central macular thickness after an uncomplicated cataract surgery in patients with and without diabetes mellitus using the OCT. Materials and methods. This is a prospective comparative study conducted at a tertiary care institution in Kerala, and the study period was 1 year. The inclusion criteria included patients having senile cataract with media clarity to obtain a clinically interpretable OCT image, and preoperatively normal fundus or presence of diabetic retinopathy without macular edema. Exclusion criteria included previous history of any intraocular surgery, presence of any retinal or choroidal diseases other than diabetic retinopathy, history of treatment for diabetic macular edema or proliferative diabetic retinopathy within 6 months prior to the surgery, or any intraoperative complications, any postoperative complications other than macular edema. About 50 patients were included in this study, and the patients were classified into two groups. Group 1 included 25 eyes of patients with diabetes mellitus, and Group 2 included 25 eyes of patients without diabetes mellitus. And all these enrolled patients, after getting an informed written consent, underwent a detailed history taking and baseline ophthalmological evaluation, including visual acuity, slit lamp examination, and a dilated fundus examination using indirect ophthalmoscopy. After the fundus examination, the patients with diabetes were classified into patients having no diabetic retinopathy with mild non-proliferative diabetic retinopathy, that is mild NPDR, moderate NPDR, and severe NPDR, based on the International Clinical Diabetic Retinopathy Disease Severity Scale. And a preoperative baseline OCT macula evaluation was done using radial scan using the Topcon Maestro OCT machine. And after an uncomplicated phacoemulsification cataract surgery, all these patients were followed up postoperatively using an OCT macula at 1 month, 2 months, and 3 months. Coming to the results, both these groups had a comparable age distribution. At maximum, patients were included at 61 to 70 years, with a male preponderance in both the groups, with 64% in diabetic group and 72% in non-diabetic group. Coming to the lens status, both groups had a comparable lens status, with maximum patients included with nuclear sclerosis grade 3 and posterior subcapsular cataract. The diabetic retinopathy status of patients in the diabetic group had 16% of patients having severe NPDR, 32% each with moderate NPDR and mild NPDR, and 20% patients were not having diabetic retinopathy. Coming to the comparison of mean central macular thickness, within each group, the mean baseline CMT showed an increase to the mean CMT at 1 month, 2 month, and 3 month postoperatively from the baseline values, which was statistically significant. And in each group, the increase in mean CMT from postoperative 1st month to 2 month, and the decrease from 2 month to 3 month was also statistically significant. And on comparing the mean CMT between the groups, the baseline mean CMT values change was not statistically significant between the groups, but there was a statistically significant difference in the mean CMT values in the group 1 compared to the group 2. And at the 1 month and 2 month, the difference was statistically significant, but at 3 month postoperatively, the difference was not statistically significant. Comparing the mean CMT values with the diabetic retinopathy status of the patients, at the baseline, the mean CMT values were not much different among the groups having no diabetic retinopathy and mild, moderate, or severe NPDR. but the mean CMT values were increased in all the groups at 1 month, 2 month and 3 month postoperative period, which was statistically significant, and the increase was more in the severe NPDR group. Coming to the discussion, in a study by Ikegami et al., it was showed similar result with increase in the postoperative CMT values at 1 month, 3 month postoperative visits in both the groups, and which had higher values in the diabetic group, but the significant difference was not noted between both the groups, but it was different from our study, which showed a significant difference between the groups, and peak value of increased CMT was noted at 1 month in a study by Kohn et al., but we had obtained comparable values with our study in another study by Gabriel et al., which showed increase at 2nd month. And also in a study by Kim et al., the diabetic retinopathy status are compared and showed an increase in mean CMT more at the severe diabetic retinopathy values. So the conclusion is that increase in the macular thickness occurs in both the groups after cataract surgery, and the amount of increase depends upon the retinopathy status of patients with diabetes mellitus. These are my references. Thank you.
Was all the surgeries done by a single surgeon?
No, ma'am.
So that is a bias, no?
Yes, ma'am.
There is a difference. Yes. Did you, all surgeries were uncomplicated?
In the cases taken in our study was all uncomplicated.
Okay.
How did that macular thickness came down at the end of 3 months? Was there any change in the treatment?
No, ma'am. Treatment was not taken. In the third month.
What is your post-op regime?
Post-operatively, we used to give topical antibiotics and topical steroid since 3 months, up to 3 months, and a topical nepofenac was given for diabetic patients.
Correct. So, if you put the patients with only one group on nepofenac,
Yes, ma'am.
do you think it's acceptable?
No, ma'am, that's a limitation.